Over the course of the year, we've distributed 4,724 parcels to clients. And that figure, with the exception of the pandemic, has continued to rise year on year. Last year, when we spoke about our parcel distribution, we explained how people had to make really difficult choices. They had to choose between eating or heating or clothes. But what we've seen this year is that people are actually not even able to make those choices anymore. We have clients who are coming to us who can't afford to put on the heating or to cook, but also don't have food and also can't access clothes. The amount of opportunity they have to at least make a choice has even been stripped back away from them. Just under half of those parcels went to children under 16 years of age. Obviously, any parcel going to anyone is one parcel too many, but it's quite distressing that actually those who are youngest and perhaps one of the most vulnerable groups in our society do not have access to nutritional food in their homes. What surprised us was actually that figure was not higher. Nationally, we've seen big rises in food bank need. We've heard about food banks that are running out of food on their shelves. We've heard about 25, 35, in some places in our community, over 50% rises in food bank use. What surprised us was we're not seeing such big rises. It's been a year-on-year rise, but not quite as significant as some of those big figures. So that meant we wanted to go back and have a look at what was happening in our local community. Why was it that we were not seeing such a huge rise in referrals to the food bank and therefore parcels? And what we found actually surprised us greatly. Because actually, when we looked at individual clients coming to the food bank, we had an 18% increase, which brought us back to pandemic levels, or within 1% of pandemic levels. So what we're actually seeing is the need is great in our community, but something is happening that means that people are not being referred as often to the food bank. Now, obviously, that is our aspiration, that food banks are only used for crisis support. But when we are in a long-term crisis, like the cost of living crisis, we expected to see more referrals, even if it meant that people were using us for more than 3 vouchers in 6 months, which is one of the sort of aims that we look for within our food bank. We also found that the number of clients seeking long-term support actually fell. So the number of people needing more than 3 referrals fell by 5%. So this made us ask quite a number of different questions about what we were seeing within our community. And actually the reason is complex and multifaceted. As we reached out with our participation work, we heard from clients who again shared that they were incredibly embarrassed to not just ask for help from the food bank, but to ask for help at all. This normally was people within the older age bracket, but more and more we saw people who are working full-time, who are really struggling with mortgage payment increases, with food inflation being above 19%. All of these different things, along with energy, were pushing people who worked to need to access support. But often they didn't know how or were embarrassed to do so. We also found that over the year, as things became more challenging for people, especially over the winter, they encountered capacity issues for referrers. And we're going to talk a little bit more about this as we explore our referral pathways and what we're seeing there. But actually, people who did want to ask for support often found that they couldn't. Wait times were either too long or phone lines were over capacity for people to actually call in and get support through channels that they knew would help them traditionally. But we have seen some really good news on this as well, that actually our approach to advice first, our signposting and support, our work with Citizens Advice through our Citizens Advice advisors and with other partners is having a really positive effect for helping people who are in short-term crisis overcome that and then get back on their feet again. I'm going to be looking at that a little bit this morning as well. A quarter of those accessing our service appear to be new to the food bank. So it shows people who have never needed to use at least our food bank before are being driven into food poverty and needing support. And on top of that, 12% of people who didn't need to use the food bank last year but had used us in the past, perhaps during the pandemic, had to return to using our service again. So we're seeing a lot of new people come in to use the service, a lot of returning clients who maybe have moved out of food and poverty, being driven back into food poverty once more, needing to use our service this year. And we especially saw that over the winter. December 2022 was our biggest month on record. We dropped down a little bit in January, but February again was our biggest February ever on record, and March our third biggest month this year. So you could really see people who were struggling over that winter period as the energy crisis really bit home, but alongside that they were struggling to find food to feed themselves and those in their households. So we saw a continuous increase in provision during that period. This year we had 99 different referral partners referring into us at the food bank. That's a huge number of different referral agencies we are working with and trying to look at how we can make sure the clients being referred in get that advice and support to deal with the underlying issue they've been facing. But sadly, we've also had some referral partners who have had to step back. And that's because of the fact that they just simply do not have the capacity to do effective needs assessment, to be confident about the referrals they're making, or even just to talk with people who are in need and identify who needs support. And that's especially true within the secondary school sector, where we've had some big partners who were referring families into us and ensuring they had support, having to step back this year. Despite those secondary schools stepping back, education accounted for 30% of all of our referrals this year. So that's a huge number of referrals that are just coming in from one particular sector. Schools are an incredibly important partner to us at the food bank. They often are in rural areas where maybe other support isn't available to families, but they're also a trusted partner for families. They know that they can turn to schools and ask for help. So it's really important to us that we are working with schools to ensure that support gets out to those families. But we do also recognise, and again we'll touch on this in a moment, that schools simply do not have the resource nor the knowledge base and skill set to ensure that advice is given to families to deal with many of the issues that they are facing. For instance, a school would just not have the ability to help a family that is in debt. And sometimes schools don't know the pathways to ensure that family gets support or to ensure that they can be referred on. Obviously, this year has seen other support in place as well. And the one thing that we recognise is that the Cirencester Food Bank is not the only organisation that is providing means of emergency support through to people who are in need. The Household Support Fund has done some amazing work to ensure that people in need within our local community have access to supermarket vouchers, along with other cost of living necessary payments. We've also had smaller types of food provision out there, which predominantly are there to try and deal with food waste, such as community fridges, but we know that people who are facing food insecurity are using them. So we know other provisions out there. And one of the provisions this year was the cost of living payments that were given out in July and in November. Cotswold Trust, in their report this year, said that they saw a dip in both months that they attributed to the cost of living payments. Sadly, we can't be that confident that they've made a big difference for us. We have seen within our data that we do have a drop in referrals in November, but actually we don't think it's big enough to have an impact with the cost of living payments. What it doesn't show us, though, is what would have happened had those cost of living payments not been in place. Had they not been there to provide support to people who were on universal credit and benefits and needed it, we might have seen much higher referral figures during that period. And as you can see, despite this slight dip, we suddenly see a return as we approach December into very high figures once again over that very busy December, January, February, March period. So I touched on what we call referral pathways, and I want to just unpack that a little bit more. We're not going to go into as much detail here as we do in the report, so obviously if you are able to, you can download that from our website, or you will have a copy mailed to you. But what we've seen is quite interesting within our referral pathways into and out of the food bank. The food bank works on referrals for very important reasons. We want to make sure that our provision gets out to those who really need it. And having a referral process means that we can do needs assessment with our partners on those people who are coming in to use the food bank. But it also helps us collect essential data on the reasons why people are being forced into food poverty, which allows us to share that back then with our community and see what gaps there might be in service or where we've got capacity issues. So our referral pathways look at all of that coming in. We're also keen to ensure that where possible, when clients are referred into us, they get advice first. That's our model, that's what we're looking for. A client has an opportunity to talk with someone about the issues they're seeing and get support for that before they're referred in to the food bank, because there might be a more dignified route for them. And then if necessary, they're referred onto us. So having good partners who can do that assessment wherever possible is really important to us. And therefore we define a few partners as what we would call a primary pathway for people. And those are partners who are open to the public. We've got a lot of partners who provide really, really good advice, but they might need to be referred onto. So perhaps referred on by a GP, referred on by the local council to other partners. They're not necessarily open to the general public. So where they are, anybody who wants support can just call up and get it, and they can be offered advice on a range of different things. Those are what we're looking at as our primary referral pathways, and those are the ones that we publicise often on our website so people know the route through. And traditionally, that's been organisations like Citizens Advice who provide amazing support to people and give them a whole raft of advice, but also have regulated advice for financial issues, debt advice, and so on and so forth. So that's been a really great pathway for us. Over the past year, we've seen a national agency, which is also organised by and run by Citizens Advice, but in partnership with the Cotswold Trust, become a key referrer to us, and that is Help Through Hardship. So Help Through Hardship, also providing a lot of advice there for support. But ideally, we would like people to be accessing advice at a local rather than national level. Over this year, we believe we have seen some significant issues in referrer capacity. And that, again, probably doesn't come as a surprise to you sitting in the room. As we've had more and more people who need support and help, we've often found that they're waiting on call lines for up to an hour or even can't get through because phones are at maximum capacity and can't take them. We've seen more clients than ever since we've started recording actually call the food bank directly to ask for help. And our aim when that happens is to route them back through a referral partner that can address the needs for the crisis that they're facing. But even we have struggled at points to get them referred back through because of capacity issues. And that's actually resulted in a few rare occasions where we as a food bank have had to issue a voucher and parcel to the clients ourselves. And that is not something we are looking to do going forward. It's not the way that we want the process to work. But we've had calls from clients who have medical issues, who have gone without food for sometimes up to 4 days. and we couldn't sit back and try and navigate the referral pathways while we got support into them. And sadly, those sort of situations are becoming more and more prevalent. So we want to work, obviously, with our referral partners to see how we can be navigating really smooth referral pathways. We're keen to support again, educate people with what we're seeing so that the capacities can be increased. But it means that actually our support and advice teams have had to take a little bit more on this year to actually bridge that gap in support. As a result, we've also looked for other primary referral partners this year. So we were pleased to bring GRCC's Community Wellbeing Service on board with us as what we'd call a primary referral pathway, so that people are now able to self-refer into them to they'll look at the issues that the client is facing, and if needed, refer on to us here at the food bank. But to illustrate the sort of issues we've seen, I think this graph gives us a good indication of what's happening. So we can see here that the blue line is our citizens' advice primary pathway. And this has traditionally been our main referral pathway in for clients. But then as we've gone throughout the year, as the crisis has taken hold, we can see that that's slipped down into its lowest points here over the winter. But as that happens, we can see the help through hardship line picking up. So some of that, what's happening with citizens' advice, will be because of the fact that clients are listening to the advice given and acting upon it. But what we're also seeing is that capacity issues are driving people to other pathways into us. You can see GRCC that's come on as the primary pathway, again, picking up to take some of that slack in the winter. Even where we see citizens' advice and help through hardship being at lower levels, and this is on a different scale, our maximum referrals in still remain much higher. And at this point, we were getting clients contacting us saying that their wait times for help through hardship were over an hour. And if you're working full-time, you can't spend an hour on the phone to get through to an advice agency. If you're in a poor mental health state, spending that length of time on the phone is not going to be helpful or even achievable. So what we saw there was where we had even more referral agencies trying to get people through to us, those referral agencies that might not have normally referred to us coming in. So capacity has had a real impact this year on referrals in. And that might attribute to why we don't see as many referrals despite high numbers of clients. That might be one of the factors within that. So as you may know, back before the pandemic, we launched a new partnership with Citizens Advice, which allowed us to fund some dedicated food bank advisor time from Citizens Advice. And that had a huge impact upon supporting our clients who normally are seeing very complex issues. Sadly, that was paused in October of last year as our CA advisor at that time stood down from their post. But we were really pleased that this year in March, we've not only recruited, Citizens Advice re-recruited for that post, but actually we've expanded that provision from 2 days to 4 days of advisor time, but also 2 days of debt advice time. So a lot more work that we're doing within that area. And we can see the impact of that within our financial inclusion figures. So that the figures in green with the green background are what we've done directly within our food bank. The blue background is what our referrals through to Citizens Advice have achieved. So bearing in mind this was just from April to October last year for Citizens Advice, whilst we had our advisor in place. But our own volunteer signposting team made an amazing 306 signposting interventions over the past year. So that's working with clients to make sure they have both advice on how to deal with the underlying issues they're facing, but also referrals on to other agencies. Through those referrals, we saw 58 clients directly referred in to our CA advisor during that period. And that is normally those clients that we identify that have more complex and challenging needs, especially those that have priority and non-priority debt issues will be referred through to our CA advisors. And that CA work, so the advice work, meant that we had an estimated 24 clients that felt they no longer needed to be referred back to the food bank. So that's really good news. We can't be certain that, especially with the cost of living crisis, that they won't find that they have dropped back into food poverty as that bar increases that everybody has to try and stay above. But actually, that's really positive that we're seeing people who have been referred to us, often who are really complex cases and have needed to use the food bank over a number of years, feeling that they no longer need to use our service, which is very exciting. With our provision last year, we committed to making sure that not only would we provide food and other essentials such as household and hygiene support through to people who are using the food bank, but actually we would also ensure that those that were on prepayment meters would receive energy support. Now, we obviously work with our partners to do that. Warm and Well and Citizens Advice are key partners in ensuring that energy support gets out. But we've also, through a new partnership with the Fuel Bank Foundation, been able to give out 120 vouchers since last summer, which equated to £5,424 worth of financial gains. Alongside that, we've identified through our own needs assessment families and households that are really struggling and been able to give them an additional, on top of the parcel, supermarket voucher that can only be used for food and household items. And so we've distributed £7,500 worth of Tesco vouchers so people can buy things like fresh meat or cheese, fresh milk, other items that otherwise they simply would not have been able to afford. Through our partnership with Cotswold Trust and Vodafone, we've given out 21 different SIM cards. So communication, again, we class as something that is essential for people's day-to-day lives. It's been obviously essential over the pandemic, especially where children were learning at home. But to stay connected to their support networks, it's really important that they're able to make those calls, but also stay online so they can look up how they can provide and get access to other support. And whilst we don't have an exact figure on how much those SIM cards are worth, we estimate that there's been over £1,000 worth of, again, financial gain to clients as a result of those SIMs being provided. And again, a partnership with the Yellow Bus, which was great locally, meant that we distributed over £1,000 worth of vouchers for their charity store. So where people were struggling maybe for clothes or perhaps for toys, especially around Christmas for children, they could access that support through the Yellow Bus scheme. So in total, over the past year, we've seen £42,420 worth of debt managed for food bank clients. We've seen £7,461 worth of debt written off through our CA partnership. £10,416 worth of financial gains through that CA partnership, but an additional £14,932 worth of financial gains through our own signposting and advice work. So there's some real support going to clients who have been referred into us, on top of just the emergency provision. And we attribute this work to also driving down those repeat return figures for referrals. We've had clients who have come back to us after having energy debt, housing debt written off, who have said that they do not need to use our service again, which obviously is a great result. And we have lots of case studies from clients that we've talked to where they don't know how otherwise they would have broken free from food poverty had that support not been in place. So I hope that's encouraging. We talk obviously a lot about the issues we're facing, but actually by using early advice models, by using financial inclusion strategies, we are helping people to break free from food poverty. Obviously, at the moment, whilst we're in a cost of living crisis where that bar is being raised every single day due to inflation, it can be challenging because even by maximising their income, it means that they may not get above that bar. But as we start to see inflation fall, hopefully they will find that they are in a much better place and able to move forward without food bank support. So I think that's really encouraging and a great opportunity for us to look at how more of that can be modelled within our community and what we can be doing together. I spoke at the beginning about our participation work, working with experts with lived experience. And this is incredibly important to us as an organisation. We don't just want to lead from the top. We want to ensure that we are driven, our services driven from the ground up, but also that people with lived experience who know the challenges that they're facing better than any of us, who know what they need to move out of those crises better than any of us, are able to input into that and to drive not just our service, but thoughts upon how service across our area can be improved. And that's been really interesting. Our participation, I talked about how sometimes change takes a while. Our participation work and project work there didn't start until January of this year, so quite recently. But actually, it's already seeing some incredible stories brought back that we can act upon to help people within our communities. So some of the things that we're seeing within our participation work is repetition of certain key issues that are coming up that are keeping people, if not trapped in food poverty, trapped in food insecurity. Obviously, financial inclusion and actually having enough money is a key thing that people are reporting upon. That's probably goes without saying. But we do live in a very rural area. Sometimes we can forget that, being in the heart of Cirencester or some of our market towns. But transport again and again comes up as a key issue for people. Not just the issues with transportation links, that people trying to get into areas where they can access cheaper food, where they can access support, but also being able to learn how to drive is just too expensive for people. Being able to run a car and put fuel into it is just beyond their reach. And for most people, therefore, that means that they cannot access opportunities for work, which will help get them out of food poverty. They can't access the support that they need. Despite our remote working now, they can't get in for meetings. It can drive the sense of isolation, which can drive their mental health down, which makes it difficult for them to deal with their challenge. So transport has really been key within the stories that we're hearing across our area. Childcare comes up time and time again. Obviously, there can be some great support for families where there are free spaces, but that only works if there is capacity for those free spaces. And through families, we're hearing about the issues where they just can't. They're calling up every week to try and see if they can get a space in preschool settings, and it just is not available to them. So that's proving to be really challenging for families, and obviously that's driving them then to not be able to get work, which means that they are trapped within food insecurity and food poverty. Other themes that we've come out, obviously, again, being in a rural area, especially for older people, is isolation. We talked to a number of people who were older, and they said that not only are they isolated, it means they don't know where to turn for support. They're not connected to the internet in the same way maybe that other generations are, so they can't access that. And they don't have people who come into their community to tell them how support could be given. Or if they do, it's a little bit like a bungee cord. Someone comes in and is at a meeting but then goes away again. So if they miss that talk, that information about that provision, suddenly that's not available to them anymore. So there's some really key themes that are happening. We've also been able to work with our partners, which has drawn out some very interesting themes. So a core part of our participation is not us going out there, it's us working with our partners. There are some amazing community builders and other workers out in our communities. And we're really keen, therefore, that we're developing links with that so we can share our learning, our understanding about what's going on in our communities, which is what's causing problems for people. And what we've seen through conversations with other partners is that there can often be issues with people accessing support, even though there's a lot of support on tap. And that's really interesting for us where, we might be putting a lot of support into the community, but people are not accessing it, but we know the issues are there. What are the barriers there? Is it about building better relationships within the community and trust, or is it about the accessibility of the provision that's being offered? And we can learn that both from our partners, but also from those with lived experience who need to access a service. Again, all of this that we're doing is not because we're trying to be working in the community, not because we're trying to become an advice service. It's because we want to try and learn as much as we can so we can share it back with you. Because every one of you, whether you are an advice professional, whether you're providing support, whether you're a neighbour of someone or someone who lives in the village, all of us have a part to play in ensuring we can move towards a place where we can drive down food poverty in our area. And if we work together, that is something we really believe we can achieve. So the more that we can share with you, the more we learn, hopefully the more you can share with us, then we'll have an opportunity to be much more effective in providing support. The first thing we want to do is share better quality data and insight on the reasons for poverty with you. You will note, as one of the things I've said, there's maybe a few things this year I haven't said. We haven't really shared with you those drivers that we've seen for people being referred to us this year. And that's because the top two reasons were low income and child holiday meals. Low income. Should be no surprise to any of us that people on low income are needing to access our service. And given that I've just presented that 30% of our referrals coming in are because of education sectors, again, child holiday meals should come as no surprise. So they don't really tell us anything new or groundbreaking that we think we can share with you at this time. But we are pleased that actually our referral process has changed, and the Cotswold Trust have developed their referral platform so that going forward, we can catch much more nuanced data and information about why people are being referred into us. And that's really important because, again, we can share that back with you. That came into effect in April, so it comes into place after the information we're sharing on this report. But we can already see that, obviously, increased cost of living is a big driver for people being referred into us. But physical and mental health issues is much higher than we ever imagined. So there's some really key pieces of information there that we hope going forward we will be able to share with you that might help us understand how we can better address the issues that are causing food poverty and where we might have capacity issues in services that need support or where we might have actual gaps in service. So we're looking forward to sharing that with you in the future. But we're also going to be looking more at wider data. Some of the things we've started to look at this year is how things like absolute child poverty can help us understand what's happening in our areas and how does that align with our food bank referrals or with other data we have from partners. How does universal credit benefits or housing benefits, are we seeing places where actually we would expect higher referrals given the level of need that's out there in our communities? And what can we do to ensure that there is no unmet need that isn't being addressed? Because before we look to drive down food bank numbers, we need to make sure that actually we're supporting all of those who need to use the food bank. We're looking to build in more capacity ourselves. So one of the things we're looking to do there is we want to be working with our volunteers so that they are taking on more roles that will help us to understand more within participation. So growing participation teams within our work, looking at how we can build capacity into our signposting and advice. But also, again, where we see that there are capacity issues in our community, communicating that out. Where we hear that clients can't get through, communicating that back to the partners where they're having challenges and seeing what we can do together to make those pathways more accessible. I've talked a couple of times now about education. Again, education settings are key partners for us and are really important to ensuring support gets out there. But we know that there are barriers to actually addressing the underlying issues that lead people into food poverty. So we're really pleased that this year we're going to be recruiting for a new role and starting a new project.
As a result of co-funding through the Simonson Foundation, we're able to recruit for a family engagement worker. The family engagement worker will be working with a select number of partner schools and looking to model initiatives that provide advice and guidance to families that are struggling with food insecurity, but also those who are starting to find times tough, to make sure that they get advice before they fall into food poverty.
So that's a key focus for us this year that we're going to be launching, hopefully, following recruitment in September. As an organisation, we have been a bit guilty of not being client-centred. Our work means that we get clients referred to us through a voucher, and therefore we look at the voucher. And probably the most client-centred we get is where we look at how many vouchers a client has had over a certain period of time. But what we've started to unpack this year with our data work is that we can see clients who have used us for a number of years for many different reasons, through many different referral agencies. We want to know, when advice is given, what impact that advice has had. Has it been successful? Has there been barriers? So we're really keen to be working with our clients much more holistically and wholly to see what their journey has been like, rather than focusing on that voucher, because we can believe that can produce much better results for our clients in helping them out of food poverty. And obviously, we've talked about this, it's really core for us that actually we are not doing for, but we are doing with. And therefore, including people with lived experience, because they have the expertise we know on how to drive this forward, is a key part of our work over the next 12 months. We just cannot bring about this vision to end need for food banks alone. It is something that we have to do together, and something that we truly believe we can do together. And we're excited for the next 12 months to see the impact of our work across the community and how that can help people to not only get out of food poverty, but to stop falling into it in the first place.